What is anti-aging medicine?
Anti-aging means generally to not get older, fight against the aging process, and that aging process will continue as we move into time further in advance. If you look at the history, thousand and thousand years back, kings of their states used to send their people out to see and seek for some solution so they can remain young, youthful, and live longer. And since those time, actually, we've been looking for a solution so everybody can remain young and healthy. Now, there are so many research have been done in this area, but there is no conclusive evidence that why we age, why the cell function slowly decline. There are so many theories proposed, and there is no one exactly accepted yet. But if you look at it, there are so many multiple factors takes place here as well. So it's always gonna be difficult to exactly find out what is each factor is in your case. So when people ask us that what do you offer for that purpose, we try to explain to the patients that the main thing that what they can do is to avoid 4S, avoid sedentary lifestyle, avoid stress, avoid sleeplessness, and avoid smoking or any bad habits that is causing aging faster actually. Now if you look at the disease that causes earlier death are heart attack, stroke, diabetes, obesity. So if you control that, then you're doing anti-aging already. But this American Academy of Anti-Aging Medicine, this book has about 10 products named that we explain to the patients that if they're really interested, they can look at those 10 products. And the 10 products is actually says in the beginning that these are the nutritional supplements or medication which have been claimed to possess anti-aging or longevity properties, and they've been selected for that reason. And I will briefly explain to you what are these 10 products and how people can use it to make themselves younger or anti-aging purposes. And it works on different aspect of the function. One is metformin, which is used widely for diabetes. It improves your insulin resistance, has shown to reduce cancer incidence as well. And once you reduce your insulin level goes down, you can definitely do better with everything. Other product, second product is statin drug, which has shown to lower cholesterol levels, reduce the risk of heart attack, and also reduces the inflammation. It's anti-inflammatory. Aging is basically inflammation developing, and that's why it could be helpful. The third one is astragalus extract, and astragalus extract has shown to improve the telomere shortening. What happens this our genes, chromosome has a DNA, and in the tip has a tip of this DNA are called telomeres, and their function is to protect these chromosomes. Its function is like in a shoelace there is a metal clip, or you can call a cap. The purpose of this metal or plastic cap is to prevent damage to the shoelace. If you understand that if you remove that cap, what happens? The thread is easily damaged. So this same way, when the cell divides, this telomere starts shortening. And if we can prevent the shortening, somehow they found out that we can actually prevent aging. And there is a Nobel Prize given for this telomere testing as well, and a lot of research on telomeres. There was an article in the National Magazine about that as well. And the product, one of the product is TS65, which is very expensive, but that can be used if people interested again. And the fourth one is very much is actually a lot of doctors would agree that one of them is omega-3 or fish oil capsule, which enhances immune function and reduces inflammation. Also helps to reduce triglyceride and improve some lipid profile in a better way. Then the vitamin C, which reduces very good one of the antioxidant so it helps to reduce oxidative stress and free radicals, but you have to take in a high dose in the study. Another product is vitamin C, that has been a very powerful antioxidant which reduces oxidative stress and actually removes free radicals, but it has to be taken in a high dose to have anti-aging properties, and there are a lot of research on that too. Other product, next product is vitamin D, and vitamin D has been found to be low in most of the people that we screen now, and particularly in obesity. The fat actually stores vitamin D. It's fat soluble, so in the fat is stored, so not in the blood, so most of people are deficient. So vitamin D helps with a lot of muscular functions, smooth muscles, heart muscles, bone health, inflammation, endocrine function as well. And then another product is called resveratrol, which actually has antioxidant properties and also mimic caloric restriction. We find this in the red wine as well. So why red wine is good and very healthy is probably for that reason. And I think if you look at the content of the one wine bottle compared to this one capsule, pretty comparable. So if you're not drinking alcohol, you can use that one. Another product is coenzyme Q10. CoQ10, whenever you take any statin, you should take CoQ10. That has shown to help with the mitochondrial function, muscle health as well. So it's very good. It has anti-aging properties. The next one is DHEA. DHEA is one of these hormone, comes from the cortisone, and it helps to combat neuroendocrine hormonal decline. So we have 7 products out of 10 products that is recommended or proposed to have some anti-aging properties. The other 3 products that are not here, one is metformin, which is actually a prescription medication for diabetes, pre-diabetes and hyperinsulinemia, and the statin, they are cholesterol medication, and so that are also prescription medication. We don't routinely prescribe for people for anti-aging purpose right now, but if they have a high cholesterol or inflammation in the vascular tree, we can always use it with that indication. And the last product which is not here is carnosine, which has been shown to help with preventing the cross-linking of the protein in the cell, and that helps to, that one of the theory that cross-linking of protein causes aging, and the carnosine can be helpful with that.